Hi, I'm Ted Venema. Let's talk now about Meniere's disease. Meniere's is a not so common pathology of the cochlea or inner ear. Its prevalence is about 100 to 200 people per every 100,000. So it's more common than an eighth nerve tumor, which is 1 out of 100,000. But it's, again, as I say, it's a not so common, but it does affect people, and its effects are those that you wouldn't want to wish on your worst enemy. It has some nasty ones. It's named after a physician named Prosper Meniere, a French person, and he's the first person who discovered a connection between balance disorders and the inner ear some years ago. At any rate, the causes of Meniere's disease, we are not so sure. Some think it's an autoimmune disorder. But again, we aren't 100% exactly what causes it. Let me advance to a picture here that shows the cross-section of the cochlea. This would be the petrous bone, the hardest bone of the body. And you can see in this picture that the cochlea is really not so much a presence as it is an absence. It's an auger-shaped hole dug into the bone. So these orange circles representing the base of the cochlea, the midsection, and the apex of the cochlea. Interestingly enough, if you're looking at the base of the cochlea, you can see that the hair cell region right here is actually narrower at the wide base of the cochlea, and it gets larger and larger as you get toward the apex of the cochlea. We're going to come back to this in a bit, but I just wanted to prime our listeners and watchers on that particular thing before we do. At any rate, if you'll see on the sides here, you'll see these dark areas called the stria vascularis. This is a stripe that winds all the way up the cochlea, and it is the feeding or tropic and blood supply to the organ of Corti, or the hair cells and supporting cells inside the scala media of the cochlea. As we know, the scala tympani and scala vestibuli are filled with cerebral spinal fluid, also known as perilymph, whereas the scala medias, the areas inside the triangles, are filled with endolymph, the chemical opposite. High in sodium, low in potassium, high in potassium, low in sodium. This difference in chemical compositions is what does enable the cochlea to work much like a battery, giving an electrical charge. At any rate, some people think that excess endolymph secretion by the scala or by the stria vascularis is the cause of Meniere's. Others think it's a lack of absorption by the endolymphatic sac of the cochlea that allows the excess buildup of fluid. But nonetheless, the bottom line is Meniere's is known to be associated with an excess fluid buildup of endolymph fluid in the cochlea, which is why it's called endolymphatic hydrops, too much fluid. And again, some think that's caused by excess secretion of fluid by the stria vascularis. Some think it's because of a lack of absorption of the same fluid by the endolymphatic sac. The symptoms of Meniere's are generally three. The classic symptoms are known as episodic hearing loss that comes with rotary vertigo and roaring tinnitus. These three are the classic symptoms of Meniere's disease. Now, it should be said right here that all Meniere's disease is endolymphatic hydrops, but not all endolymphatic hydrops is Meniere's. In other words, some people have Meniere's, but they don't have all three symptoms. And so there's a bit of an overlap here, and this is important to bear in mind. And Meniere's tends to affect one ear in 80% of cases. For the few unfortunates, it'll also affect the other ear. Sometimes it goes through its course with one ear, and then when that ear is finished, it starts in the other. It tends to leave people with greater and greater degrees of sensorineural hearing loss. And we're going to look at the type of audiogram now associated with Meniere's disease. When we see this audiogram with Meniere's, it tends to be a rising sensory neural loss, which is a more unusual shape of sensory neural loss, because as we've seen, most sensory neural loss drops in the high frequencies. This goes in the opposite direction. You can see this person has normal hearing for the right ear, and his Meniere's is in the left ear. Now, I've drawn this orange stripe across in order to unroll the cochlea, so to speak. When the cochlea is unrolled, it's about 3 centimeters in length. And we're unrolling it in order to show the apex of the cochlea and the base of the cochlea. And you might say, well, why is this apex wider? You thought the cochlea gets narrower toward the apex. Well, that's true, but the scala media in the cochlea gets wider toward the narrow tip of the cochlea. And the scala media is narrower at the wide base of the cochlea. There are 1 row of inner hair cells all along the length, but did you know that at the base there's 3 rows of outer hair cells, and here there's 4 rows of outer hair cells, and here there's 5 rows of outer hair cells. Now, why does Meniere's present with a rising audiogram? It's because this area here has more mass and it's less stiff. The walls are less stiff. And so excess endolymph can bulge like my cheeks, can bulge the walls here more than it can bulge the walls at the stiffer base. And that's why the effects are seen more in the low frequencies than in the highs. This also brings another point that too many people don't appreciate about the cochlea, and it explains why low frequencies are represented here and why high frequencies are represented here. We mentioned the words mass and stiffness. Well, mass tends to resonate with low frequencies, which is why when you're sitting in your living room and someone's playing music upstairs, what comes through is the bass guitar and the drums. Those lows resonate mass, whereas highs resonate stiffness. If I had a stiff spring, it's harder for me to pull and push on it slowly, but if I it's easy. So high frequencies stimulate the bass, not because high frequency waves are short, not at all. It's because high frequencies resonate with stiffness, and low frequencies resonate with mass. I mean, think of a 250 hertz tone. It's 4 feet long. A cochlea unrolled is 1 inch. So a sound wave isn't fitting in here. Traveling waves have nothing to do with sound waves. Sound waves are taking place in air, whereas traveling waves are a fluid wave as a result of sound waves. So they're different. At any rate, back to Meniere's, let's talk about treatments. Treatments for Meniere's are usually oral steroids, usually. And if these work, then the disease is thought to be autoimmune in origin, because steroids often can work with autoimmune disorders. So if that's great, then that's what's done. An endolymphatic shunt is another treatment. This is a shunt put into the endolymphatic sac in order to reduce the pressure of endolymph in the scala media. A newer treatment is an injection of gentamicin into the scala tympani. Gentamicin is one of those aminoglycoside families of pharmaceuticals. They are known as being ototoxic. Many drugs ending in the term mycin tend to be ear toxic, ototoxic, with the exception of erythromycin. So at any rate, so what that does is that tends to kill off balance cells. And they do that on purpose. They inject that into the scala tympani, by the way. I'll go back up to here. They inject it into the scala tympani, hoping that it will seep into the cochlea, but not the cochlea so much, more into the semicircular canals and the utricle and saccule. You're trying to kill off the balance areas in order to alleviate the awful effects of Meniere's. Another newer treatment is called vestibular neurectomy, and that's going in surgically and sectioning or cutting the vestibular portion only of the 8th nerve and allowing the hearing portion of the 8th nerve to remain intact. This surgery is quite difficult to do and is time-consuming. All in all, Meniere's has awful symptoms. It's episodic. The person with it often experiences an aura, much like someone who has seizures. He or she knows that an attack is coming. It's like, oh no. And here it comes, the rotary vertigo, the roaring tinnitus, and the episodic sensory neural loss. That tends to recover to some degree, but after repeated bouts of Meniere's, the sensory neural loss increases by degrees. Sometimes the Meniere's leaves after having run its course, and it's done. Some say its course can be 5 years or more. At any rate, this has been a little exploratory tour into the world of Meniere's disease. Thanks for listening.